This video submission is my final head-to-toe assessment. Now I'm going to introduce myself. My name is Annabelle. I'm a student nurse from Durham College. I'm here to do head-to-toe assessment. Is that okay?
Yes, Annabelle.
Okay, I'm just gonna do a quick environmental check. Okay, starting from your suction, your air, your oxygen, your nasal prongs are present, your opposite side rail is up, and your your bed is in my working height. Your drapes are on for privacy. Your lighting is okay, is working properly, and your call bell is within the reach. So I see that you are awake, relaxed, and you're alert. Your facial expression is relaxed, and your skin color is congruent to your skin background. There's no sign of distress. So, are you in pain? What brought you here?
I feel dizzy.
You are dizzy. So, can you describe the pain?
It feels like everyone's spinning around me, everything.
So, what did you do to make it better?
Just resting
What did you do to make it worse?
when I'm doing activities.
And is it like radiating in
It's just on my head,
in your head? So from 0 to 10, how would you rate your pain?
like a 7.
7? I see. So how often you experience this
Maybe a
headache?
few minutes or so.
And what does this mean to you?
Maybe I'm really stressed with things.
I see. So I had an assessment a while ago about your vital signs, and your temperature is 36.8 Celsius, which falls under the normal range of 36.5 to 37.5 Celsius for a normal adult, and your your pulse is 72 uh, 72 beats per minute, which falls under the normal range of 60 to 100 for a normal adult, and your respiration is 18 uh, 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 breath respiration is 18 breath per minute, and it falls under the normal range of 12 to 20 for a normal adult, and your blood pressure is 118 over 72 millimeter mercury for a normal adult, which falls under the normal range of 90 to 60 to 140 over 90 millimeter mercury for a normal adult, and your oxygen is 98 for in room air. So now I'm going to to ask you uh, if you know where you are.
I'm in the hospital.
You are in the hospital, and do you know what month of the year?
It's just 3rd August.
What about if you know our Prime Minister?
It's Justin Trudeau.
Oh, that's good. So you are awake and oriented to time and place and person. Okay. So I just gonna check your pupil. Okay. If you could look at my shoulder. Okay, and you look at the tip of the pen. Good. So your your pupil is equally round, radiating to light, and accommodating. Okay. So now I'm now I'm going to inspect your upper extremities. It's symmetrical. Your color is congruent to your skin background, and and it seems there's no bruises, there's no lumps and bumps, there's no cyanosis, and there's no edema present. Okay, so I just gonna put your hand straight, and I'm just gonna palpate your skin. Okay. So your skin is dry and warm to touch, and now I'm going to locate where is your brachial artery. So your radial arteries are, your radial pulse are strong and present bilaterally. Now I'm going to just put a pressure on top of your hand. If you could push it towards you. Good. So it means that your muscle strength is equal bilaterally. Now I'm going to check your capillary refill. So your capillary bed, your nail bed is blanching in less than 3 seconds, and it comes back. So now I'm going to check your skin in your chest. Okay, it seems symmetrical. Your ribs are sloping downward, and your skin is there's no cyanosis, there's no edema present, and there's no pallor. And now I'm going to palpate your chest. Okay. So there's no masses, there's no tenderness. Okay. Your anterior posterior is 1:2, which means is less than the transverse diameter. So now I'm going to listen to your chest. Okay. If you could exhale and inhale while I'm moving the diaphragm. Good. Good. So at this point, I did not hear any adventitious sounds such as crackles and wheezes, and I will assess if there's any gases, tracheostomy, if there's any chest tube present. Okay. Now I'm going to check your heartbeat. Okay. So, starting from your aortic on the right side, second intercostal space, S2 is stronger than S1. Pulmonic is on the left side of the sternum, second intercostal space, S2 is stronger than S1. Moving on to Erb's point is third intercostal space, S1 is equal to S2. Tricuspid valve is is on the fourth intercostal space. S1 is stronger than S2, and your mitral valve is in the fifth intercostal space, in the mid-clavicular line. S1 is stronger than S2. So now I'm moving on to your abdomen. Okay. So if I could just lift up your shirt to expose your abdomen. So I see that your skin is congruent to your skin background. There's no edema, there's no pallor, there's no cyanosis, and your skin is congruent to your skin background. So now I'm just gonna palpate your. I'm just gonna listen first to your abdomen. Okay. So I start with the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. So at this point, I did not hear any. I should hear at least 5 to 30 vowel sounds, and if I don't hear that, I would listen to 5 full minutes in each quadrant. So now I'm going to palpate your abdomen. Okay, using my 4 fingers, 1 centimeter down. Okay. Left lower quadrant, right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. So at this point, I did not feel any tenderness, and there's no masses. And did you change any of your diet lately? Like no. When is your last bowel movement?
Maybe 2 days ago.
I see. Did you experience any vomiting, nausea,
No, just
constipation? Good. So I will assess any dressing. I will assess any colostomy, ileostomy, and Foley catheter if there is any. Okay. So now I'm moving on to your lower extremities. I see that your skin color is congruent to your ethnic background, and your hair in your lower extremities is evenly distributed, and there's no pallor, there's no edema, there's no cyanosis. So at this point, I just gonna I just gonna palpate your skin, okay? So your skin is dry and warm to touch. So now I'm going to locate where's your popliteal artery at the back of your knee, and your dorsalis pedis. So they are present and strong bilaterally. So now I just gonna put a pressure on top of your leg. If you could push it towards you. Good. So your muscle strength is equal bilaterally. So now I'm just gonna check your capillary refill. So your nail bed is blanching in less than 3 seconds, and it comes back. So is there any, if there's any catheter, drainage bag, or gases, I will assess if there's any. So now I'm helping you to check your posterior back, okay? Okay, so I'm just gonna expose your back to check. So I see that your back, your skin color is congruent to your skin background. There's no pallor, there's no cyanosis, and there's no edema present. So I'm just gonna palpate your posterior back, okay? So there is no tenderness, there is no masses, and your spinous process is perfectly aligned. And now I'm going to listen to your posterior back. If you could breathe in and exhale and inhale while I'm moving the diaphragm. Good. So I don't hear any crashes or wheezes and adventitious sounds such as crackles and wheezes. So if there's any gases in the posterior back, I will assess if there's any. So the head to toe assessment for my patient is done, and I will relay to the doctor if there is any. Okay. So what's your plan for today?
I think I'm just gonna rest.
That's good. Okay. So that's the head to toe assessment.